The purpose of this session today is to get you started and to discover and explore what your communication needs are. So today we have a session overview. So we're going to talk about the definition of communication, exactly what it is, the communication triangle, and how you can train other people, navigating crowds and noisy places, which is very, very difficult for people with hearing loss. And also when speech reading isn't an option, because most people with hearing loss, we do speech reading. So what is communication? So communication is a transfer of information that is received by another person. So it's a transfer of information and the other person receives it and understands it. It is essential in building and maintaining relationships with other people. It involves three components that we will be talking in detail today, and that is speaker, the person who's speaking, the listener, the person who is listening, and the environment, which is extremely, extremely important for someone with hearing loss. Before I get started on those components, I'd like to say that hearing loss is not the same for everyone. So some things that I talk about today, some examples that I will present in terms of my own experience as a person with hearing loss. And hearing loss is not the same for everyone. It really depends on the person's their hearing loss type, the level of hearing loss, the environment, the noise, the distance, their personality, their mood, attitudes, fatigue, if they have tinnitus. So there's lots of things that impact communication, and hearing loss is not the same for one person to the next. And that's what makes it a little bit challenging for people to understand hearing loss, is because, okay, so what works for one person may not work for the other. And so that's today I'd like to try to cover most in terms of common themes for myself, my experiences as a person with hearing loss, and also my clients that come to visit me. They've shared stories with me on what works for them and what doesn't work for them. And it's not necessarily what works for me, for example. So everyone is unique. So, the communication triangle and hearing loss. So, I'll be talking about each of these components in detail to give you a better understanding of how it impacts your hearing loss. So, first of all, we have the speaker, the person who is speaking, the listener, the person who is listening. So, that would be the person with hearing loss. The environment, the physical space of where they are. So all of these are integrated and they all connect with each other. So let's talk about the speaker, the person who is speaking. So the person may be speaking in person, virtual, like we are today, over the telephone as well. So those are the main ways that we would be hearing someone speaking in general. Some common characteristics impacting communication are the volume, so how loud they are speaking, the speed, how fast they are speaking or how slow they are speaking. So in general, Newfoundlanders have been told that they are fast talkers. So, and I know, like, my friends in Nova Scotia, they tend to speak at a slower pace. And I've had comments that people in Newfoundland generally do talk very fast. So it's being mindful of that and slowing down if possible. And clarity of speech is very, very important. So I've been told that I have very, very clear speech. And And a lot of times, people that I meet, and some people in my family, for example, they really do mumble. Mumbling is it distorts the speech sounds, so it's really, really important to speak clearly, to someone with hearing loss and to anyone in general. Being a good communicator to everyone, um, you know, it goes a long way in being a good communicator. Accents, a lot of times we encounter people who have accents. They may be from away and they would have an accent. So for me, in my experience with people with accents, usually it's when I have to call a 1-800 number. So it could be, say, I need to call my insurance provider, for example, and I pray that I do not get someone with an accent. And usually I get someone with an accent. So it is it's a real challenge for me, personally, when I'm on the telephone speaking to someone, that maybe they have, an accent, um, and from another country, for example. So it is, and it's become very common, for people, in call centers to have an accent. So I have different strategies for dealing with that, and that's, explaining that I have hearing loss and asking them to repeat, and also, verifying what I hear as well, to ensure that. And I'll talk more about that. So also, mustache, beards, um, are difficult for people with hearing loss to lip read. And most people with hearing loss do lip read because they automatically are trying to fill in the blanks of what someone is saying. A mask. As we know, COVID was traumatic for a lot of people with hearing loss, especially myself as well, and a lot of our clients. It was extremely traumatic when everyone had to wear masks. And then, the shutdown was fine, but when we got back out into society and started grocery shopping and, but masks were still required, it was extremely difficult to be able to know what someone was saying. And it was frustrating. It was really frustrating because it was just no way around it. So there were from COVID, um, there were some new ways that came about in terms of communicating, that I'd like to share with you. Uh, that New technology came about. So a lot of, it was terrible, but some good things came out of it in terms of technology for people with hearing loss, definitely. The next component is the listener. So the listener is the person with hearing loss. So they may be diagnosed or undiagnosed with hearing loss. So there are many people who actually are not aware that they have hearing loss, or they may not truly recognize it. They may say that, well, they just have a hearing problem in certain situations. So not really diagnosing as a person with hearing loss. So, there are a lot of people that are not diagnosed that are having hearing loss challenges, having hearing challenges. So, and it's, being aware of that, and also, educating other people about that. Um, and so that's why it's good to be a good communicator all the way around, because you don't know who you're interacting with, because hearing loss is invisible. You can't see it. It's really hard to tell if someone has hearing loss unless you tell them. So it's very, very important for a person with hearing loss to speak up and say that they have hearing loss. And not just saying they have hearing loss, but also saying what the other person needs to do. So, stating your communication needs is very, very important. So some common characteristics impacting communication for the listener is their level of hearing loss. Whether or not they have mild hearing loss, is their experience is going to be very different from someone who has severe hearing loss. So someone with severe hearing loss is likely going to need a lot more support. So they may need amplification technology, for example. The hearing loss in one or both ears. Some people have hearing loss on one side. Some people have it in both ears. So the person with one-sided hearing loss, generally they will do better at hearing than someone with hearing loss in both ears. The use of amplification technology, so whether or not the listener uses technology to help them hear, or if technology is available to them, or if it is working properly as well. So I know several people who say, well, no, the hearing aid is in the drawer. So it's not in their ears, it's in the drawer. So, and also some people will say that, well, I don't put my hearing aids in until I go out. I'm in a social situation, that's when I'll put my hearing aids in. So, what they really need to realize about that is when you're not wearing hearing aids all the time, your brain, it's harder for your brain to interpret what it hears when you're out in that social situation. So really having hearing aids in all the time is going to keep the brain active and training it in terms of what you hear. So it's very, very important to use the hearing aids all the time, basically. As soon as you wake up and then you go to bed. The hearing aids really need to be in the ears. Now, you can have a break. There's nothing wrong with listening breaks as well. I encourage listening breaks. But it is important to keep the brain active because we hear with our brain. Fatigue is yeah, so fatigue for me, if I am tired, I have another chronic health condition, so that makes me very tired, and so that affects how well I hear as well, how well I'm able to understand what someone is saying. And tinnitus. So tinnitus is ringing in the ears. So I have that as well. And tinnitus, some days are good and some days are not. So when I have it on a day that is extremely loud, I am struggling to hear what someone is saying. I just can't hear over that noise that's in my head. And there's other disabilities, as I mentioned. So for me, it's a chronic health condition, something else that I have, and maybe other disabilities like attention deficit disorder, the ability to concentrate. Different types of disabilities can impact how well we're able to hear. The level of speech reading skill that someone has. So all of us have various levels of the ability to speech read. And that's why we teach speech reading, is so that people can improve their speech reading skills. And I've been told that I have really good speech reading abilities. And which really helps me in noisy situations, for example. So I can fall back on my speech reading skills when I'm not able to hear in that type of environment. So it's really, really, it's an important skill to have. So let's talk about the environment. So the environment is the physical space where the speaker and or the listener are. So the physical space could be the home, the workplace, recreation center, shopping center, place of worship, another person's home, restaurant, personal vehicle, public transit, conference rooms, like if you're at a workshop, virtual platform like today, and over the telephone. So I put telephone there because I've been on the telephone with people and they have their TV on full blast, and I'm trying to speak to them, but I can't hear their speech over the TV that's playing in the background. So that's why I did put that there. Is because telephone, when speaking to someone over the telephone, you really do need to have a quiet environment to be speaking to someone for them to be able to hear you clearly. So some common characteristics impacting communication are background noise, and that can include fans, that can include computers, various background noise. It includes people talking, having side conversation, people walking around. So if you're in the mall, for example, acoustics. So acoustics is about the sound. When you go into an environment, if you hear sound, your voice bouncing off the walls, if you hear an echo, then that means that the environment has poor acoustics. So it would need acoustical treatment, for example. So a space that would have carpet on the floor, for example, would generally have good acoustics normally, or even, curtains in the windows. And some houses, for example, open concept would be difficult for some, may be difficult for someone with hearing loss to hear in. More walls in a house, the better able they're able to hear. The acoustics are better. Um, but like my house, for example, I moved from a house that I guess closed concept, if you want to call it that. It had walls for every room. And then I moved to an open concept home where the living room, the dining room, and the kitchen are all one room. And I couldn't understand why I was struggling to hear in those environments and in that house. And I realize now it's because it's open concept. And I've had to explain that to my family. Like I'm struggling in this environment because it is open concept and sound is traveling. Lighting conditions as well. So lighting conditions are very, very important because that if the lighting is poor or dim, it affects our ability to lip read. So I'm very aware of, an environment that I go in and the light is, if it's dull or dim, I ask to have the lights turned up, for example, so that I can have the ability to speech read. Seating arrangements. So depending on where you sit, that's going to impact the ability that the listener will be able to hear. So let's say going to a restaurant and sitting next to the door to the kitchen. That is not going to be a good place to sit because you're going to get all that background noise from the kitchen and plus the door opening and closing and the staff going back and forth. So seating is very, very important. Glare from the windows as well. That impacts the ability to speech read, and the use of microphones and speakers. So some public spaces may not have microphones. So that's going to impact how well someone hears as well. Also, if the microphone generates a lot of feedback, the whistling, the buzzing or whistling sound, or it's poor quality, then, it's going to impact how well someone hears as well. So that's the three components, and I know I went through that really quickly, but the three components of communication. So when one of those things is weakened, then that impacts and communication can break down. So what can you do when you're the person with hearing loss? What can you do to improve communication with other people? And one of the real most important tip that I have for anyone with hearing loss is to train other people. So our association has done a lot in the way of creating awareness of hearing loss and how people, how to speak to people with hearing loss and speaking clearly and all of that. But, everyone's hearing loss is different. So we can speak in general, but we have been, over the years, we've done presentations to nursing students, pharmacy students, medical students, recreation students, 50 plus groups, Lions clubs, and many other community organizations. And I meet with people one-on-one as well and educate them on and their family on how to communicate, because communication is a two-way street. So really, everyone needs to work together. And so the onus is really on the person with hearing loss to train other people in your space, in your life, about how to communicate effectively with you. So it's really, really important. And I have 8 tips here. So you want to make sure that you get the person's attention first, and you can share this with other people. And I will send out a handout about these communication tips, and I'll send out a handout with regards to the communication triangle. So, the person with hearing loss, you really, you need to get the person's attention before talking. How many times has someone has started talking, and by the time I know that they're talking to me, I turn to them and I've missed the first part of what they said, and I have to ask them to repeat. So they're doing double the work. So it would be easier if they called it my name first, got my attention, and then I'd look at them. And then, and that takes away all of, doubling the work. So, so that's really, really important. And, walking down the hall as someone is talking and things like that. So you really need to make sure that they are facing you. Make sure faces are clearly visible as well. Reduce or eliminate background noise. Extremely, extremely important. People with hearing loss find it really difficult to hear in noisy situations. And do not shout or exaggerate speech. Speak clearly and concisely. Repeat, rephrase, write it down, or use a speech-to-text app. So when my daughter was 5 years old, and it's easy to train other people. It's just that they've been communicating with you probably for a while, and then if you've developed hearing loss later in life, then your communication needs have changed. And so it's easy for them to forget. And unfortunately, we have to remind them. So, but my daughter, as I was saying, was 5 years old, and, it's easy. I could easily teach her, how to communicate with mommy. And, I used to say to her, okay, can you repeat that again? Or can you use a different word for, that means the same thing of what you're trying to say? Or, write it down. Now, back then, we didn't have speech to text app. So that's how technology has evolved since COVID, is that, the availability of speech to text apps. So it is easy to teach people. It's just a matter of reminders. So speech to text apps are on mobile phone and or tablets. So basically, you could go into a restaurant or a noisy place, or just having, one-on-one with someone and finding a speech-to-text app in your app store, and, conversations of what people are saying will come up on the screen and you can read it. It's really, really cool technology. Use hearing assistive technology if asked. So this is if a person with hearing loss is asking someone to use technology to help them hear. use it basically. Include you in the conversation. It's really important because a lot of times people will start talking to, if it's two people, three people in the conversation, um, and they know that one person with hearing loss is going to struggle, so they are basically talking to the other person. Um, so that is it is nice to be able to include them in the conversation and speak to them and try to those communication strategies should help. And the very last one comes up a lot when people come in to see me, and it's their significant other or people in their family are talking to them from another room. Um, it's really, really difficult to be able to speak to someone, if you're in the kitchen and they are in the um living room, it's really hard for them to be able to hear. So it is important to go get their attention or go in the same room and speak to them. So let's talk about the really, really difficult crowds and noise. So navigating crowds and noise is really difficult for someone with hearing loss, most people anyway. So my tips for that are first of all, train other people. So my tips on training other people was in the previous slide. Educate them, tell them what you need. Explain you have hearing loss and background noise makes it difficult to hear. So, even if it's at home and you have family over for dinner, it is difficult. So it's about, making them aware and coming up with ways to help with that. So one of my solutions that I have is, whoever is sitting next to me. So it's usually my mom, and I'll let my mom know now. Can you let me know when the topic changes, for example? And she'll let me know. Okay, we're talking about this now, and then I'm able to participate, you know? So that's one strategy that we have because a lot of times everyone's talking over each other. And so, I do educate them like, okay, what are we talking about now? Or, guys, can you talk one at a time kind of thing. But sometimes it's nice to have a buddy at the table to sort of help you fill in the blanks as well. Verify what you think you heard. So sometimes, and sometimes I get it wrong and everyone laughs and you just have fun with it, right? I say, so are you talking about this? And, they say, no, we're not talking about that, it's something else. So, you got to have a little bit of humor with it too. And, verify what you think you heard. And also, that helps them instead of having to repeat everything because sometimes you do get it right. Sometimes you get the first part right, but maybe you didn't get the last part right. So then it's not so difficult for them, not so much work for them to help you fill in the blanks. Um, Use your speech reading abilities. So I definitely, when I'm in a noisy situation, I tend to focus on the person's lips. And because there's been a study that has been done that speech reading, it does improve the ability to understand what someone is saying by 30%. So honing in on your speech reading abilities is really, really important. And we teach speech reading classes here as well at our office. And that's, the goal is to improve the speech reading abilities. And plus we have Read Our Lips online that helps as well. So you can definitely check out our website about, speech reading classes and about Read Our Lips online. So moving to a quieter area, I oftentimes do that. Yep, let's go to a quieter area where I'm able to hear and speech read. Using hearing technology. So, That's important because sometimes the technology you're able to, and it could even be that, let me see here. So you're using a microphone. So it could be a pocket talker, for example, or it could be an FM system or a little microphone that connects to your hearing aids. And you're able to, hear that person, and it'll block out the background noise for you. So that's really, really helpful. And speech to text apps have become very popular. So in this situation, it would definitely help. So I put in this picture because it is something that happened to me. Uh, let's say 20 years ago. So when speech reading isn't an option, and so in this picture, this scene is, see, the picture is me, and I went through an amber light. And so the police came up, lights flashing, it's nighttime. The lights are flashing, and so I pull over, and the police officer comes to my window, and he's saying something, and I have no clue what he's saying. And the reason I don't know what he's saying is because I can't see his face. And the reason I can't see his face is because the lights are flashing from his vehicle. So the lights are flashing. It's nighttime and I can't see his face. So it was it was embarrassing at that time. And so of course I said, okay, or officer, I have hearing loss and I have no idea what you're saying to me. Can you write it down? I know I went through an amber light. Is that why you pulled me over? So, I'm just trying to fill in the blanks basically of what I think happened. And so he was very nice, and he had a notebook and he did write down, and I was able to see what he was trying to say to me. So, again, I had to train him. I had to tell him what I needed, because if I didn't, who knows what would have happened. So it was a very eye-opening experience for me then, for sure. And I've never been pulled over since, so I try to avoid that whenever I can. Um, so you want to explain that you have hearing loss, you cannot see their face to lip read when speech reading isn't an option, okay? And there's different situations for that. So it could be that a telephone conversation, so you can't see their face, right? So verifying what you think you heard, and a lot of times if I'm talking to someone and I'm collecting their address, for example, so postal codes are difficult. So I would say, okay, A as in apple, number one, and N as in Nancy, or G as in George. So a lot of time, and then the other person say no, T as in Tom. So I'm training them to do the same thing that I'm doing. So that's all about training other people as well. And other situations are virtual meetings when the camera is off. So if the camera is off, if at all possible, ask for the camera to be turned on. If not, then, use captioning if that's available to you on that platform. So there's different things that you can do, and also, use technology. Maybe there's amplification, a headset or something that'll help you hear better in the platform, or maybe you have Bluetooth on your hearing aids. And driving at night with another person. Um, so trying to have a conversation when you're driving at night is dangerous, because if you're looking at them, trying to speech read, but you can't anyway because it is nighttime. So you might want to say, okay, let's talk when we get to our destination. At a dimly lit restaurant, our staff experienced that last year. We went to a restaurant for our Christmas dinner, and it was really dark there. So I really struggled. I was really fortunate to be around people that work with people with hearing loss and understand. So everyone really helped out in terms of helping me understand or helping me know what was happening or what we were talking about, kind of thing. So that was difficult. So we've made a pact that we won't be going back to that restaurant next year. And we did ask for the light to be increased, and it just couldn't be brightened. Let's see, mask and plexiglass barriers. So when someone is wearing a mask, I had the experience there a few days ago when I was at the hospital, and some staff are wearing masks. And so, I would explain that, okay, I have hearing loss, I can't see your face. Can you repeat what you said? And, oftentimes I'll have them like move a little closer to me so that I'm able to hear what they're saying or, get them to write it down or whatever. And plexiglass barriers too are somewhat challenging, depending on how clear it is that you can see the person behind the glass. If they're speaking into a microphone, it is helpful. So that can be a barrier as well. And so, there's different tips that you can use. So there's speech to text apps. The most important thing is explaining to other people what, you're struggling. You're having difficulty hearing and what you want them to do. So it's really, really important. So it's important to figure that out, what your hearing needs are, what works for you and what you're comfortable with. And that concludes my presentation for today. So the key takeaways that I have for you today is understand your own communication needs. Model good communication and train others. So, like I said, when I'm on the telephone with someone, I'll say, okay, is that A is an apple kind of thing. So you model that and other people will do the same. Keep up to date on resources and technology. It is always changing. Um, the Bluetooth technology is advancing, as well as speech to text apps. Virtual platforms are advancing as well. So all of that, even telephones and headsets and everything, it is advancing. So keep up to date on that. And we try really hard to be on top of all of that. And we have in the loop list that people can add themselves to it, or we can add you to it, and we send out regular emails about new technology and new resources available. So you can certainly join. Just go to our website. And advocate for hearing accessibility. So, if you're in a space that doesn't have a microphone, for example, so if you're in a place of worship, or if you're, let's see, at a conference and or at a Lions Club's area, and it doesn't have hearing accessibility, or some other community recreation center, explain to them about hearing accessibility, that, it would be nice if they had a microphone, at least have a microphone. And then there's other technology that they can avail of, like group listening technology. So we have lots of information about that, and we actually have a grant, a public accessibility grant, that they can possibly avail of. So, encourage people to reach out to us for more information on that. So that's it for me today. And this is our contact information. All right, wonderful. Well, thank you, everyone, and have a wonderful day. And I look forward to seeing you again.